Hi, I'm Stephanie Hertz, Marketing Director here at Work Forest Retirement Community. Today I'm sitting in the conference room that is utilized by our Resident Council Board and its subcommittees. It's my pleasure to introduce today to you Amy Lynn Vocu. After undergraduate studies in communication disorders at Bob Jones University in Greenville, South Carolina, Dr. Vocu earned her Doctor of Audiology at A.T. Still University in Mesa, Arizona. Board certified with the Certificate of Clinical Competence in Audiology, she is also a fellow of the American Academy of Audiology. Motivated by a desire to work with individuals with hearing loss in the medical setting, Dr. Vocu enjoys the combination of patient care and technology offered by her role as an audiologist. She specializes in auditory processing disorder testing and looks forward to more research and better treatment options for tinnitus. With a hearing loss of her own, Dr. Vocu has personal experience with wearing hearing aids. Recognizing the emotional, social, and physical effect of hearing loss and other ear disorders, her medical philosophy is based on treating the patient as a whole person. Having a father in the U.S. Air Force meant that Dr. Vocu frequently moved around throughout her childhood until high school, when her family moved to Virginia, a place she now considers home. Today, Dr. Vocu will be talking about hearing, auditory processing, and hearing devices.
Good morning. How's everyone doing this morning? Bear with me. This is my first Zoom presentation. It's a little bit easier when you can see everyone and kind of interact with everyone. I think there should be a chat box open. So at any point, if you have trouble hearing me, let me know. Otherwise, we'll be taking questions throughout. Our moderator will be kind of helping me at the end to read through some questions and go through more details. I'll try to keep an eye on the chat box as well. Otherwise, like they said, my name's Amy Vocu. I'm one of the audiologists at Riverside. I have been with Riverside for about 7 years now. I've been practicing audiology for about 10 years. And so I actually did one of these presentations about 3, maybe 4 years ago. So if you saw me then, same person. But otherwise today, I just want to be able to go through a little bit more with you as far as hearing loss and things that involved related to that may be of interest to you. Again, at any point, have questions, I'll keep an eye on it. Otherwise, I'm going to save time at the end for us to go through it a little bit more and discuss things further. All right, otherwise, I'm going to share my PowerPoint here. And bear with me. Definitely pros and cons with technology, but definitely a learning curve for me. All right. Here we go. So hopefully everyone can see this here. All right. So again, I want to discuss a couple of aspects related to hearing as well as auditory processing, which is with an area of audiology I specialize in, as well as hearing devices, kind of what's out now, what's coming, what are going to be some changes that we should be seeing just in the market with things over the next couple years. I do work for Riverside. We have an office in Newport News. We also have one in Williamsburg at this time. At some point, we'll be having one in Hampton. We had one in Gloucester. So we're around kind of the area here seeing patients. All right, so a little bit about what an audiologist is. So we are a healthcare provider. We're trained to evaluate, diagnose, manage hearing loss. We also work with patients with tinnitus, central auditory processing disorder, as well as balance disorder. So we do a number of testing involved in evaluating hearing, balance, anything related to the ear is what we would be involved with. I do have my doctorate in audiology and am licensed by the state, as you all heard earlier. So I'm going to go through just a little bit of anatomy. Some of this may be pretty familiar to you, but just kind of start through the system here. All right, so this is the outer ear. We all know this very well. The outer ear is responsible for kind of catching sound and does help to improve sound a little bit. So if any of you have ever tried cupping your ear and putting it forward, you'll notice you hear a little bit better. That does give you about 3 to 4 decibels more of sound. Not that we want to all go walking around talking with our hands like that, but that is what the outer ear is responsible for and how it connects in there. Learn how to use the little pointer thing here. All right, and the middle ear is what, so this would be the outer ear is over here, sound is going through here, here is our eardrum. The 3 little bones that are in our middle ear that are often on sort of trivia questions are here. And then this goes into our, what's going to connect to our inner ear. This is what kind of gives the power to sound or through that transmission center there. All right, and this is our inner ear. So as you can see, this is where it's located. It's much smaller here, but this would be kind of a blown up view right here. In here, if anyone has heard about kind of what causes some types of hearing loss is damage to the inner ear or the outer hair cells or the inner hair cells that are in the inner ear, that's where these would be located, right in the spiral, kind of looks like a snail or a shell here, but the spiral is frequency oriented. And so the lower frequencies are in here. And as you go on around through here are the higher frequencies. So the higher frequencies are in these hair cells here. So these hair cells are what's crucial as far as many types of hearing loss conditions here. Over time, they do become damaged. If anyone's interested at some point, if you Google a video called hair cell dancing, I was going to try to put it on here, but I wasn't quite brave enough to try a video on Zoom. You can actually see how the inner ear or one of the hair cells move to music. So you can see the intensity of it as it moves. It's kind of a cool little video. All right, so the next part of the system we call the CANS, or the Central Auditory Nervous System. So this is basically what the brain does with what we hear. So here you can see the outer ear, middle ear, inner ear. And then the sound is going to go through our nerve, our hearing nerve, and then it's going to go on up into the brain. And you can see there's 2 pathways here. I'm not going to go real in depth into the kind of neurology anatomy component here, but this is an aspect that is sometimes the forgotten portion that we don't think about when it comes to hearing. We kind of focus in on this part of the ear, but without this central part working, it doesn't really matter what this part is doing. It does, but it's not as if the brain isn't doing what it's supposed to be doing, then this part is sometimes what's kind of missed or overlooked here. So again, the sound would come here and go through the nerve and then up into the brain, where the brain would process what is coming through. So it processes the sounds, distinguishes one sound from another. It's also what's crucial in distinguishing speech from noise. And so this whole part of the system, again, very crucial for what the brain does with what the ear hears. So that's kind of the connection there. All right, so this is just kind of I think a handy dandy little chart for kind of how everything connects. So again, the sound would be picked up here, sent through the outer ear, and then sent through this through the ear canal here, which does help to improve a little sound. So everyone's ear canal is shaped a little different. Most people are shaped a little different from ear to ear. We're all a little asymmetric, which is normal, but the sound is sent through here, through the ear canal here. And then once it hits the eardrum, it is going to vibrate Those vibrations are what move the ossicles, so the bones in the middle ear right here. And there's the names right down there. The ossicles are then going to send that vibration through what we call the oval window, which is going to be kind of right here where that stapes connects to, between the middle and the inner ear. And so then that is going to kind of transmit everything into the cochlea right here, which is what we kind of consider part of our inner ear. And that's where the hair cells are located. So that signal is going to be convert that sound into electrical signals, which is going to be sent through here and then sent through the nerve right here. So that all kind of works together. And each part is important in that process. We do have ways to, which I'll go through a little bit of some other aspects that we can fix some of these components if they're not working, but each part is a crucial kind of component in that. I'm not going to go in this a ton, but over here is what's involved for our balance. So those are the semicircular canals over here. And so these three canals are involved with our balance and how we kind of function in motion. So if anyone has heard about the crystals or the rocks that are in your ears, that's kind of dislocation over here. When those become displaced, they can cause someone to be dizzy. And so they have to be flushed through, and that's a condition called BPPV. But that's kind of a whole nother component. I'm not going to go into balance a lot today, but that is the component involved with that. And the question on tinnitus, I'm going to cover that in just a little bit. So I will definitely answer your question there. All right, so hearing loss is the third most common health problem among older adults. And so that's something that sometimes I think is overlooked. And we don't realize how many people have difficulty with that. And I see in all ages. I work with children, 3-4-year-olds, and I would say my oldest patient right now is 101. So I do see all ages that have hearing loss, but it is a condition that does affect patients and older adults. We would say kind of that 60 to 65 age range. 80 is where we really, it's kind of the next bracket for hearing loss category. All right, so there are 3 types of hearing loss. There's conductive hearing loss, sensory neural hearing loss, and a mixed hearing loss. So these different types of hearing losses are going to be dependent on where the damage in the ear is. So I'm going to go back to this picture here. So if you have what's called conductive hearing loss, you are going to have some sort of damage to the ear canal, or to the middle ear right here. So damage to one of the ossicles in here. So that is what's going to cause a conductive hearing loss. A mixed hearing loss would be you would have damage to one of these in addition to the inner ear. So you would have multiple sites of hearing loss damage. A sensory neural hearing loss would be damage to either the inner ear or to the nerve. Sensory neural hearing loss is typically the most common type of hearing loss, especially when we're looking at aging. So that inner ear, those hair cells, there's been damage to them, which causes hearing loss. That can be caused by multiple things that I'm going to go through in a few minutes here. So that is where the site's going to be. So again, there's lots of different causes for that. So you could have wax. We would call that a conductive hearing loss. And so that can make it to where I'm just not hearing as well as I was. It can make tinnitus worse. It can cause some ear fullness. And so that's something typically if someone has significant amount of wax, we recommend to see an ear, nose, and throat doctor, and they will clean that out for you. And for some people that resolves most of their symptoms. So something small can make a big aspect there. The other component would be aging, as we said before, as a third common condition there. Over time, there can be damage to the hair cells, leading to what we call sensory neural hearing loss. Noise exposure. So those in the military, I see a lot. We work with a lot of veterans. We work with community care with the VA, and so we see a lot of veterans that had noise exposure. Some who hearing protection wasn't as good years ago as it is now, especially in the military. So we see 70, 80-year-olds with a hearing loss due more likely than not to noise exposure when they were in the military. Hunting, shooting without hearing protection also can lead to that noise exposure. Genetics can be a factor there. And so that is something we can't necessarily prevent in all things, but that is something there is genetic testing that can be done to see if you have a condition related to that. I actually have hearing loss and I wear hearing aids. I've worn hearing aids about 10 years now, had hearing loss longer than that, but it took a while for me to kind of get to that point. And I did some testing and I do have some genetic components for my hearing loss, and I do have a sensory neural hearing loss. But that is factors where it can be any age. It's not only age related when it comes to that hearing loss. Head traumas, damage to the brain can lead to hearing loss. We also see that often related to what I'm going to talk about a little bit later with the auditory processing. And then there's many other medical conditions that can be related to hearing loss or make you a risk factor for that. So here are some signs of hearing loss. Difficulty understanding your friends or family, having to ask them to repeat what they say, saying what and how more often. Notice that you're turning the TV up or the radio a little bit louder than you were before. Used to be on 12 and now you're at 20. Those are all kind of indications that maybe there's something else going on. Difficulty hearing on the phone, having to have people repeat a little bit more. I know many patients that end up just using speakerphones, they can hear it a little bit better that way. Having tinnitus, which we would define as ringing, buzzing, humming in the ears or in your head. So I know there's a question about tinnitus over here. And I'm gonna have a slide here and talk about that a little bit more. As well as sensitivity to loud sounds. So if someone says, you know, loud sounds just really bother my ears, it's painful, it's uncomfortable, especially if it's something new that you're not used to having, that would be another kind of sign of hearing loss. When to get a hearing test. So with a hearing test, we are looking at, we first look in your ear to make sure there's no wax. We'll often do a little pressure test that will make sure your eardrum and your middle ear is functioning normally. Then we do kind of the standard hearing test for those that have never had one. The first part, you hear some beeps and either raise your hand or push a button. And then the second part, you will be repeating some words. So again, if you're noticing difficulty hearing, you're having ringing in your ears, you do know you have a history of noise exposure, our veterans, hunting, worked in louder factories. If you have any family history of hearing loss, so that can be a genetic component where maybe you don't have it early on, but your mother and your sister have hearing loss, it may be worth getting a hearing test to check that out as well. If you've had an exposure to what we call ototoxic agents, so there are certain IV antibiotics, chemotherapy. Not all chemotherapies are ototoxic, but there are some that are. So those are reasons to get a baseline hearing test on you to know kind of this is where we're at. We know there's a problem, we need to address it, or everything looks good. Now we have a baseline to be able to look into a little bit further. Head injury, concussions are also reasons to look into it, as that can lead to some difficulty hearing as well as some difficulty with the processing. All right. So this is what a standard audiogram would look like. So I kind of just marked this one up here. The graph here is set up from a low pitch or frequency to a high pitch or frequency, very soft to very loud. The red O's are your right ear, the X's are your left ear. Normal hearing for an adult is 25 and above. For students, pediatrics, we want them more 15, 20 and above, but for an adult, yeah, 20 to 25, depending on kind of what you read, is going to be considered normal hearing. So here, hearing is normal. We drop into the higher frequencies, you can see hearing getting worse. If hearing was normal, all the X's and O's would be up in this compartment right up here. So that is where we like to see things up here with normal hearing. With hearing loss, this is where we see people would have more difficulty with clarity. So this is actually my hearing loss. And so I hear in my right ear, I hear the bass pretty well, but I have trouble with the treble. My left ear, I have a little bit more difficulty on the left versus the right there. So with this just shows, gives me an idea when I'm testing someone where they may have more difficulty. Is it enough difficulty to look into hearing aids? Is it something that this can be medically fixed and we want to do something about it? So when I'm testing someone, I'm looking at what type of hearing loss they have, the severity of the hearing loss, and then going from there on what would be the next recommendations. These little arrows and brackets are where the inner ear looks. So when we're doing a test, we typically during the testing, we'll put something behind your ear that's called bone conduction. And what that is doing is it is assessing the inner ear, ruling out there being a middle ear conductive component there. If everything kind of lines up within 10 of where your other markers are, lets us know that it's a sensory neural hearing loss. Right. So I'm going to pause here and go ahead and answer what questions are here. Figure out how to go in this box over here. All right. So the first question is tinnitus connected to hearing loss, or is it completely different? Tinnitus is often a symptom of hearing loss. There are many other conditions that can cause tinnitus. But it is very commonly a symptom of hearing loss. So if someone has tinnitus or tinnitus, either pronunciation is correct, we do recommend that you have a hearing test to see if it is related to some sort of ear condition to hearing loss, or if it's related to medications. There's probably 50, 100 different things I could list that it could be related to. More often than not, it is a symptom of some type of hearing loss. So that is kind of our first thing to look at there before we look into other causes of that. The treatments for tinnitus. So another question, can tinnitus be treated? So it is resolved. Right now, there's not a cure for tinnitus. There are treatments for tinnitus. Again, the hearing test is our first start to see, is it due to hearing loss? We can look through medication, let's see if it's due to medication. So trying to narrow down the best we can what's going on. If it is due to hearing loss, often treating the hearing loss with hearing aids or medical treatment does help to improve the tinnitus over time. For many people who say, oh, yeah, I have ringing in my ears, I don't notice it, it doesn't bother me unless it's quiet. For many people, the brain will kind of resolve it or ignore it to the best that it can. There are some over-the-counter treatments for tinnitus. So again, as far as treating tinnitus, our first goal is trying to determine what may be a factor or cause in that, and then going from there on that. I'm going to go into a little bit more on hearing loss, and then I will come back and do a few more questions. So there are lots of treatments for hearing loss, and hearing aids are not always the only method for that. So that is where the evaluation is key. Learning, is there a hearing loss? What type of hearing loss is it? So our recommendation is regular monitoring of hearing loss. If you are of Medicare age, they will ask you now your medical wellness checks every year. How's your hearing? Are you having any trouble? You say no, they won't do anything. You say, yeah, or having this issue or that, they will refer on to audiology for a hearing test. So the monitoring of hearing loss is important to know. This is where we are. This is where we need to go from here. Once we know kind of what's happening and have the evaluation, we can further go on for medical management of the hearing loss. So there's treatments if it's an ear infection, it can be treated with antibiotics. If it's wax, it can be treated by being clean. For a few other types, there's oral or intertympanic steroids. So there are some treatments for it. Again, evaluation is the first key there. And then for those that have, let's say, middle ear abnormality or growth or a hole in their eardrum, there are some treatments, which would be surgical. That's typically done by an ENT, ear, nose, and throat doctor or an otologist. And so there are treatments where they do prosthetics for one of the little bones in the middle ear. There are some repairs, patches for an eardrum. So there are some treatments there. If nothing can be medically treated, then we're looking into devices. So cochlear implants, there's a few other implantable devices, as well as hearing aids. Another great way to treat or prevent hearing loss is hearing protection. So avoiding loud sounds, trying to protect your hearing when you are around loud sounds. Noise exposure and hearing. Noise exposure is the second most common cause of sensory neural hearing loss. Noise exposure, occupational or environmental, can lead to adverse effects of the auditory system, including hearing loss, tinnitus, and hyperacusis. Hyperacusis is just a big long word for hypersensitivity to loud sounds. So that noise exposure can lead or cause many of those conditions, and then those last three conditions are all related with that. Musicians are at risk of noise-induced hearing loss. I did a presentation 2 weeks ago, actually, at CNU with the music students, talking about hearing protection and what can be involved with that. So especially if someone's professionally a musician or plays number of times a week, they are typically around louder sounds and louder noise. So this would be different levels of loudness levels of sound. So there's very soft sounds. We're looking around 20 decibels, which is kind of near normal hearing thresholds where you hear the leaves rustling, to 140, which would be a firearm, fireworks, things like that. What we sometimes don't realize is how loud things can get, and how loud some of our daily activities are, from a hair dryer to a lawnmower, church, music at church, gyms. The music in gym classes can be very loud. They do have apps you can get. So if you Google sound level meter app, you can do an app, and they're fairly accurate. I have one on my phone I'll use sometimes when I'm out and just kind of measure. I was at a restaurant and they had a live band there. And it was very, very loud. So we measured, it was about 105, 110 consistently. So we left pretty quickly after that. But that is kind of a level of the loudness. So the kind of OSHA recommendations are to 85 being that safe level, 85 decibels for extended period of time. So that kind of says that right here. So that's something, if someone's going to be around louder sounds, you want to make sure you have hearing protection on in order to protect your hearing. Even if you already have hearing loss, that makes you more susceptible to further hearing loss. So it's something, if you're going to be at a really loud concert, if you are going to be shooting firearms, using machinery, power tools, we do recommend having hearing protection on. So I'm going to talk a little bit about devices here. People may have some more questions about this at the end here. So definitely keep your questions in here. We're going to go through it. I'll probably do another kind of question break in a second, and at the end we'll read through the rest. There are multiple types of hearing loss. There's what we call implantable hearing devices. So that would be cochlear implant, where there requires surgery to put the device in. There's what we call personal sound amplifying products. There's assistive listening devices, hearables, traditional hearing aids, and then over-the-counter hearing aids. So I'm going to go through these individually. So this is what a cochlear implant would look like. There are two different types. There's one called a Baha, and that's implanted kind of in the side of your head right here. And that is for people who maybe don't have an outer ear, who are missing the bones in their ear or have what's called single-sided deafness. That is what that device is for. It is surgically in the back here, but nothing is surgically in the inner ear. The cochlear implant, there is an electrode that is actually looped through your cochlea into the inner ear. And so if someone has a severe to profound hearing loss, they're looking at more of a device like this, which is going to kind of overtake that inner ear and try to provide some additional sound. A PSAP is kind of our short for this. It's the over the counter. You can see these at Walgreens, Amazon, devices like this. These are more amplifiers, or they are amplifiers. So they are going to make sound louder. They're going to necessarily make sound clearer. And they're not designed to be used as a hearing aid, just because there is limited control over them. So they do help if someone's trying to, for watching, listen to soft sounds. Those are things that people use PSAPs for. They're not regulated by the FDA. So the caution we have is that to control the sound, they could make things louder and not have kind of a protective feature in there. Some of these are advertised to kind of be like a hearing aid, and we played around and actually tested a few that we found, and the volume made things louder, but it again didn't make things clearer because it's an amplifier, so it's just equally making things louder. Where a hearing aid is going to be programmed based on your hearing loss, so it will provide clarity and have some noise filtering in it. They're not, these devices aren't supposed to be marketed to treat hearing loss. They sometimes are, but there is going to be a difference in that product. Assisted listening devices. So this would be something that an amplified phone for someone who has significant hearing loss, using a light that's going to signal a doorbell, what's called an FM system, where if you have difficulty hearing. So these can be used for people that already have hearing aids, or for support for those who have hearing loss. So there is amplified phones, closed caption phones. There are many churches. We don't have a lot of looped systems in our area. Some states, some countries have more loop systems. But if you've heard of a T-coil or a loop system, that uses part in the hearing aid in order for you to hear the speaker and whatever event you are at a little bit better. And so that would be considered an assistive listening device there. They also aren't regulated by the FDA. Those that are kind of created through for hearing aids have some regulations on them. Hearables, these became very popular over the last 35 years. We see everyone with an earbud in their ear now. They are ear level. Some of them are used primarily for streaming music, phone calls. They do filter out. Some of them have noise canceling in them to use when you're running. A lot of them now have features. We all have technology where it's letting us know how many calories we burn, whether it's a watch. Some of the ear devices do that as well. They are not intended to treat hearing loss, so they can be used as kind of a temporary aspect. So with some of the devices they have where you can adjust the sound, or like AirPods have what's called Listen Live, where you can turn them on and then you would hear into the device what's going on around you. So you can use it kind of as a mic system. The sound quality for that component can be a little bit noisy. As far as hearing music or hearing on the phone, it's going to give you kind of direct sound and less background noise, especially if you have something that has a noise filtering in them. All right, so hearing aids, most people have some familiarity of that, know someone who wears hearing aids. It is a wearable device. It is designed to treat hearing loss. They are a class 1 or 2 medical device, so they are considered a medical device if it's a traditional hearing aid. And it can treat anyone from a mild to a profound hearing loss. Hearing aids, traditional hearing aids do need to be fit by a licensed professional, whether that be an audiologist or a hearing aid dispenser. All right, so I'm going to take a quick break and just kind of look through questions here. So can you tell what type of hearing loss in your examination of person I can? So with that hearing test, we are looking to see what type we have in order to give recommendations on what to do next. Safe methods for cleaning your ear canals. What we don't want is people sticking things in their ears, Q-tips, shoving things in there further. Honestly, what happens. Right now, the only thing they really have for kind of over-the-counter cleaning is they have little kits that have softener drops. So D-Brox is the main brand, but it's a drop that's going to soften the wax, and you can use a bulb syringe and rinse out your ears. So that is kind of the over-the-counter way of doing it, using the D-Brox, letting things soften, and then kind of flushing it out. If someone is concerned about having a lot of wax, we recommend to follow up your primary care to kind of look in there and see what's going on, or to have someone professionally check it versus trying to do a lot of sticking things in there, which can sometimes make things worse. Does hearing loss from ototoxic agent resolve with time? It depends on the ototoxic agents. So sometimes we will see the system self-correct. So I have had patients who had, while they're getting chemo, was there, and then once things settled or some of my patients have changed, we're able to change to a different agent, and things did stabilize or improve some. It can sometimes cause permanent damage. So typically if someone is going to be receiving an ototoxic agent, we will do a baseline, and then monitor throughout for changes, and then monitor after that. And then we really like to get, once they're finished, doing another updated baseline, and then monitor about every 6 months to a year to see, is this where things are at? Is this permanent, or are we seeing the system improve there? Yes, I can fix growth on there. All right. What is the fix if my hearing aids are not letting me hear well, but putting my finger outside my ear makes voices louder and clear? Sometimes that can be the size of the fit. So if someone says, oh, I do this and I hear better with my hearing aids, what you're doing is occluding the ear canal and helping the sound resonate through. So sometimes if a patient comes in and tells me that, I'll put on a bigger dome or tip to their hearing aid to see if that does help to improve the resonation of the sound through the ear canal. And so that's something, it is playing around with the fit a little bit to see if that improves that there. All right, and then I'm going to go into hearing aids because the next question is what updates are there with hearing aids over the last 3 years. So I'm going to go into just hearing aids right here. Talk a little bit about what we're going to be seeing, what we've seen over the last couple of years. So these are the different styles of hearing aids. There's in the ear, which we've all seen in that picture there. There's it in the ear canal, which is going to be a little bit smaller. I don't know if you can really see through here, but that's kind of the size of my hand. If I were to hold it like that. There's a really tiny one we call completely in the ear canal. It's going to be that size here. Kind of see that when I hold that up there. Right. And then there's what we call receiver in the canal. That's going to look something like that. And behind the ear would be the same. There just wouldn't be a wire. There's a tube that connects that there. So those are the common styles there. Style is typically determined based on what type of hearing loss you have, your ear canal shape. And then in the end, it's very much a preference component on what's easier for someone. Is it easier to put something behind your ear? Dexterity wise, is it easier to have one piece? Visibility is a huge component in hearing aids. So it is what would be least visible for someone. So those are all, again, components there. My video is not excellent, but I do have hearing aids in here. I get a little bit closer. So there's a wire here and then a piece behind my ear right here. And that would be kind of what a hearing aid would look like. And I know many people either have hearing aids or know people who have hearing aids, and different styles here. Hearing aids are digital or programmable, which makes it different than an amplifier or kind of a PSAP. So what happens is we would have a hearing test on someone, we put it into the computer programs it based on that hearing test. We have some other equipment we call real ear measures, which also helps us in setting or programming it based on your hearing loss. We can adjust the different frequencies and the sound levels to try to improve on that. There are rechargeable hearing aids. That's been kind of new over the last 5-6 years. They've been out longer, but where they have changed the battery that they use. There are also disposable batteries. And so there are a couple different options. One's not better than the other. That's also a preference. Do you want to change the battery? Do you not? Do you want to charge it? Do you not? Goes into there. Hearing aids now have made for iPhone or Android components. So you can stream calls, media, music. So you would be able to work similar to like an AirPod or a Bluetooth earpiece where you can hear the sound that's from your phone or your tablet, depending on what kind of hearing aid you have, into the hearing aid directly. And some of them have options for kind of a hands-free phone component as well. And there's still accessories, Bluetooth accessories that you can use for your computer or your TV, as well as different remote options there. They also have, for if you have a smartphone, many of them have apps that you can use which kind of makes your phone a remote control where you can turn things up and turn them down. All right. Over-the-counter hearing aids. I think there's a question over there. I'm gonna go through my slide and then I can answer that further. This has been there's been a lot of news articles, a lot of information out on this. I'll be honest, I don't know all of the things because we aren't privy to get any more information than what you all are provided. They're gonna be a wearable device. We believe they're gonna look very similar. I think Bose already has one out for pre-order. Wearable device. These devices are going to be designed to treat people who have mild to moderate sensorineural hearing loss. So they're there to treat those who don't have other conditions going on. And for those who are in that mild to moderate category, I have a number of patients who are in that category, and hearing aids just aren't an option for them due to the price. They would benefit from it, but the cost benefit analysis doesn't quite equate. And so that's really going to be the kind of key market for these over-the-counter hearing aids, is those who need a device, but maybe don't need the sophistication and the full components of a traditional hearing aid. We believe it's going to be very similar to a traditional hearing aid, look the same, have rechargeable options, have Bluetooth connectivity options in it. They will be regulated by the FDA with labeling requirements. This is what it's designed for. We should see the release either this year or next. It was slated to be released, I believe, in 2020, but due to COVID, everything was pushed out on that. But legislation has been passed that this will be provided. We don't know all the details. We're kind of waiting to see if it's something that we can still be there to support with. It is something that will be self-fit. So patient I was looking up the Bose ones, and you do a hearing test through the computer or through a phone. And then you're provided with a device. You would be doing a lot of the fitting and the sizing on that is how we believe it will work. But it is going to hopefully be an affordable option for people, and just added treatments that are out there so that people are treating hearing loss versus kind of leaving things as is and just getting by. So I am going to scroll up. So updates over the last couple of years in hearing aids. So they've improved in how the Bluetooth is working on hearing aids. They have improved some of the analyzing speeds of hearing aids. So if you got a hearing aid 3 years ago, there may or may not be a drastic difference from what you have. They have, again, improved processing speeds. It analyzes in the environment faster and does more analyzing, so which should help better background noise and speech clarity. They have definitely made improvements to, we were finding with the updates, even 3 years ago, updating the firmware has helped because they've made some improvements for the Bluetooth components to work a little bit better. Again, yes, there's been lots of things in the news as far as the over-the-counter. So the question as far as the article for legislation for hearing aids available over the counter without a licensed professional. I think it's great for us to have some more affordable options. My concern is the safety. So if you were to do a hearing test on the computer, but no one looked in your ears, it could have just been wax, and then you purchase this device to help you hear better when it could have been fixed pretty easily. I think we're going to miss conditions. And so with that, my opinion on over the counter, even if that's the route you want to go, we do recommend for you to come in for a diagnostic hearing test first, just so we can be sure that we're not missing anything. There's nothing else medically that can be treated on that. And so again, we still want to be involved and we're hearing healthcare professionals, we're not salespeople. So we still want to be involved in treating hearing loss and care for that. It's not that I have any concern about losing a market or something to that. Again, my concern is going to be conditions being missed. Some of the testing we do rule out tumors in the inner ear. So it is important to have the diagnostic hearing test, which is covered by most insurances. And then really as audiologists, our goal is to guide you on what's out there. I can't guide you on over the kind of hearing aids yet because I don't know enough of what's happening, where again, I know everything's coming. I've seen glimpses of pieces and people that have kind of tried a couple things out, but we'll have much more information over that in the next year. All right, so I'm going to pause on questions here and go back to my slide, and then we'll finish up questions after that. So I want to talk a little bit about central auditory processing disorder. This is something I specialize in, something that some people don't know about, and that we want to raise some more awareness for. So auditory processing disorder testing evaluates how the brain hears. So during that testing, we do evaluate first how the ear hears to be sure that is not what is causing the problem. But some patients who have normal hearing and say, I just can't understand what people are saying. I'm still struggling. I can't tell where sounds are coming from. I can't tell the difference between sounds. I forget what people say. I have delayed responses to sound. So this is a disorder we want to evaluate to be sure that you say, I'm just not hearing well and things are fairly normal, but you're still having hearing symptoms. What we would evaluate would be for central auditory processing disorder. So if we know the ear hears normally, there still may be something going on. It's just going to be related to the brain. So the brain is responsible for decoding information, integrating the information that you have coming in, and organizing that auditory information as well. I test patients of all ages for auditory processing disorder. We do test patients for developmental auditory processing disorders. I test 6, 7, 8-year-olds for this disorder. I also test adults. I specialize specifically testing patients that have traumatic brain injuries. And so what we'll see many times with people who have brain injuries is they will note that they have difficulty hearing, but we test them and they have normal hearing as far as the ear, hearing sensitivity there, but because they've had injury to their brain, we will see them have difficulty hearing, understanding, remembering what is said, and functioning on a day-to-day level. So that information is very useful for therapy and treatment options. Another component that there's needs to be more research done, but they are starting to do some, is central auditory processing and related to aging. So I have lots of patients who, even with their hearing aids, will say, I hear well, but I don't understand as well. And so we do as much as we can as far as the hearing aids to improve the signal. But over time, the age-related processing can, just with aging, how the auditory system functions over time. does have a little bit more delays, a little bit more difficulty understanding and processing as quickly as it used to. So for age-related central auditory processing disorder, it refers to changes in the auditory network, which can impact our auditory perception, our speech communication. It is a little bit more challenging when we're assessing an adult, as there may be hearing loss that's involved as well as cognitive changes. So it's hard to know, is it the hearing loss that's making it harder to process? Is it hearing loss and processing together making things more challenging? Is there cognitive changes that's involved with the memory and everything involved in that? So it's hard to separate the two causes of auditory difficulty. So that is a component there that we want to be aware of and we want to improve testing for, so that we know how to address, whether it's through cognitive therapy, whether it's through how we're setting the hearing aids, but that's a component that we really need to be doing more on. And they are improving some research in this. One reason there is more research being done is the connection between hearing loss and dementia. You're going to see a lot of articles out, some research oriented, some opinion oriented. In this, research has shown a link between untreated hearing loss and dementia. So it does help to support the need to have better treatment for hearing loss. And we're hoping that changes in the market and changes in things will help to improve that. It also may show the need for what we call oral rehabilitation, or that cognitive therapy, to be involved as well. It shows a correlation. It does not show a causation. So we want to be careful to say your hearing loss isn't going to cause dementia. The research does not show that. It can just be a risk factor, which is why we want to treat it. The research is somewhat limited to really show us this type of hearing loss or the severity of hearing loss. I had a class last year, and that's what I asked one of the otologists. Well, do we know what type or severity is going to be the highest risk? They said research is just limited at this point. We can say there's a correlation, but more research needs to be done to have more kind of definitive guidelines related to that. And so we're hoping that research will improve for hearing as well as the central auditory component and dementia in the brain as a whole. All right. So I'm going to transition over here to a couple of questions. The question is, any idea on the price difference with the over-the-counter options? I don't know. I want to say you're going to be looking at a 800 to 1,000 brackets. Maybe we may get a set as low as 500. That I'm not sure for how low we're going to see that. I assume they're going to be probably marketed a little bit higher to start until things kind of take over in the market. What we may see and what we're kind of hoping to see is, as there's more options, that we may see pricing in other hearing aids also kind of improving as well. It is hard because hearing aids are expensive, and hearing aids that are sold, so a hearing aid that's sold to Costco is priced differently than what it's sold to me, and what it's sold to the VA is different than what it's sold to me. That makes it very hard in the market on how as far as pricing is. So we're hoping that things are going to be more affordable, and that the over-the-counter will be affordable. I think there's still going to be some price limitations for patients that are lower income as far as over-the-counter. But again, hoping 2022 will have a lot more answers on that. Eargo is a brand. The question is, any comment about the brand Eargo? I'm not going to comment specifically about brands because it's going to be opinion. We definitely recommend getting a hearing test first. With any hearing aid brand that you're kind of buying online, the caution would be the fit component. Not all ears fit the same. We're kind of universal. And so some products have good ideas in them, but may not fit all ears. So definitely whenever you're pushing a device, make sure that they have a good return policy. And just do some research to make sure that the company actually follows through with that return option. Because that's a little bit more challenging when you're trying to self-fit and you don't know if it's going to fit in my ear or is it not. So for the dancing carousel videos, yeah, carousel dancing, if you put that in your search box in Google or on YouTube, it will pull up. There's only one main video, but it will pull that up. And it's the same song that it's dancing to. Right. So I think I'm going to go through my last couple of slides, and then I'll go ahead and just kind of continue to answer questions after that. So if anyone has some more questions, I have 2 or 3 more slides I'm going to go through. And then our moderator, Mackenzie, was going to help me do all this, and I sidetracked. I could see it over on the side, and I just got distracted. So I sidetracked the questions already, but I will go ahead and spend kind of the end just answering questions. So go ahead and start. If anyone has questions, start typing them in now. I'm going to go through a couple slides, and I will answer the rest there. So I want to just go over some just communication strategies. So with hearing loss, we want to identify it, we want to treat it. But whether you have hearing loss, whether you have auditory processing components there are some strategies or things that you can do to help someone who has hearing loss or to ask other people to help you. So the one is with the speaker. So if someone's talking to you and you're having trouble hearing them or understanding them, sometimes it's better to ask for clarification than to just ask them to repeat what they said. So saying, if someone says something, you didn't hear them, and you say, could you say that again? And they say it again, you still don't understand them. Sometimes it's better to ask, could you reword that for me? Because there may be a keyword your brain's having difficulty processing to understand, or it may help them to slow down a little bit. So when you ask someone to reword what they said, it forces them to talk just a little bit slower. Because so sometimes when, I know I've talked a little bit fast through this presentation as well, but that is one thing with hearing loss. It does help if you can look at the person when you talk. If you can talk at a little bit of a slower rate, not that slow, like I'm just talking to you, but just a little bit slowed down, it makes a big difference to help the brain to process and give your brain time to fill in the gaps. So asking someone to slow down a little bit when they talk, asking them to look at you or face you. I know it's still challenging when we're wearing masks to hear people, and I've seen kind of a high tick up of testing people because I wasn't having as much trouble, but now that everyone's wearing masks, I notice I'm having more trouble because we lost that communication kind of compensation that you had there where you could look at their face or read lips and you got just enough to fill in those gaps. It's still going to be helpful though if they can look at you even if they have a mask on, because it's going to make the sound go a little bit more forward and force them to kind of focus in on you versus doing multiple things at the same time. Asking them to get your attention first. So this is great for spouse components is before they come in the room and they come in and their spouse is watching TV and they just come in saying, hey, for dinner, we're going to have this and then we're going to go do this. And then, the husband or wife says, what'd you say? And then everyone's frustrated. The best thing would be to say, honey, pause, might pause, and then say what you want to say. That gets their attention forward first. It helps their brain focus in on you. And it's going to give a little better chance in that communication situation there. Asking for written instructions to be provided along with any oral instructions, written checklists. So these are all things, if it's in writing, it happens a lot better. So I was talking to one of the managers at my townhome and they were giving me a number for something and I heard it over the phone and I was pretty sure they said 2270. And then I was like, maybe it's 2217. So then they came by and I saw them in person. I said, can you give me that number one more time? And it was 2212. So those are things where it helps if they're either written down, if it's numbers, it's crucial information, you can ask them, hey, could you go ahead and just email that to me? Could you send that to me? Could you write that down? Just so it helps, especially with numbers. It's difficult for anyone to hear some of the distinctions there. So that is something that I would recommend if it's important information, asking if they can write it down for you so you have it. And then you also have it for reference, you know, so you remember it later on. I wrote that number down and have it in my car. And so that's something that, again, it just makes things a little bit easier. For multi-step instructions, it's great to have written checklists. I need to do this, and I do this or that, or they told me this, that, and things there. So those are just some helpful things that we all kind of know, but just little reminders. The other thing is controlling the environment. We can't always control the noise in the environment, but if you can, that is the ideal. So sitting in a booth versus a table, sitting away from the kitchen, sitting away from the bar area, sitting outside. I know we're not always in as many noisy situations as we were, but those are things that will be helpful, so that you're not struggling as much to hear whether you have hearing aids or not, whether you have hearing loss or not. These are just ideal listening situations. Being in a well-lit place, so if you're in the living room talking with someone or you're in a meeting, having the lighting on so you can see their face. I know with masks it's a little harder, but in that, so that you can get some of those other identifiers to help fill in the gaps. If you can change the acoustics in the environment by adding carpet or curtains, some things to absorb some of those background noises as well. So the, and I believe we go till 12:15. So I am going to do the last two, and then we'll just, if anyone has questions, just pump it. We're all doing a lot of Zoom, and this is my first Zoom presentation. It's a little bit of a different kind of environment and setup. What's helpful is if you're having trouble hearing, using headphones or earbuds, so the input is a little bit better, and you can turn it up a little bit louder and balance out the volume. Zoom typically has, I believe this is being recorded, but has recordings, and some of them I believe you can have the closed captions activated. So that was something I would figure out later. We were doing through a chat box, but if I was having to listen to people, I was a little nervous about that component there. So having that closed captions, I was in a training and they had closed captions for everything, and it was just very interesting and great to have. So that is something. Not sure things are activated here, but we can definitely work on that, because that is a great option to have. Being able to have the PowerPoint in front of you makes a big difference. So if anyone has questions, I don't know if I missed anything here. But if anyone has questions, I can hang out, answer some more questions. Things here. I hit most of the questions in here. But thank you all for attending. Thank you all for listening. Again, I'm here for questions. If anyone has anything, feel free to, I'll be honest, I'm trying to learn how to use this little chat box over here and scroll up and down. I think I'm going the wrong direction, but if people have questions, let me know. Otherwise, I hope some of this was helpful. We are always here to help if anyone needs anything. Riverside Audiology, we have 4 audiologists. And so we're definitely happy to help and support people in any way we can. And I really recommend people getting a baseline audiogram and really evaluating and checking everything out here. I appreciate everyone's kind words here. Are earbuds harmful for listening podcast music? They aren't inherently of themselves. What we don't want is people listening to earbuds at earpods at the full volume. So Apple recommends about 50% volume to be a safe level. And if someone has hearing loss, you're going to adjust that some. So I really tell people just use caution. Don't have it loud enough where it's audible, but don't have it blaring. We're going to see some more, I think, more with kind of our teenage 20-year-olds, and I've done a couple of classes on that. For high schoolers, is having their music and having it loud. Likely they're going to be my patient one day. And so that's something where we want people, they're safe to use. They often improve the sound quality of a podcast or music to have that directly in your ears, but the volume is the key component there. As far as a hearing place that doesn't, the question is, do you trust a hearing place that does not test when you're in a soundproof booth? I recommend having a booth there, just for the sound component. I guess if it's in a very quiet place, that would be fine, but we do typically recommend there being some type of soundproof booth in order to do testing, and most places I know do. All right, and someone asked for our number. Our number is right here. Last month was October, and it was National Audiology Awareness Month. I know we're in November, but most people don't know that it was Audiology Awareness Month, so I just wanted to let everyone know that October was, so we can celebrate next year. And so I want people to have that. This is the name of my practice here. Our phone number is there. If you have a Riverside primary care, they can send a referral over. On our website, you can find some information as well. Can hearing aids weaken hearing because you rely on the artificial devices is the next question. That's a great question. Hearing aids, if they're set correctly, have a safety setting, so they are not going to make your hearing worse. If they're set correctly and programmed correctly, which is some of the safety settings we expect to see in the over-the-counter, there to be someone that's, as well as having someone who's trained with programming. So what happens is it doesn't weaken your hearing, but a lot of people will say, you know, when I take my hearing aids out, I can really tell a difference, and I feel like I'm not hearing as well with my natural hearing. What's happening is your brain is just used to having clear signal. And so now it sees a bigger difference with them versus out. If someone were to then go a couple days, they'll say, oh yeah, now it's kind of, I hear how I did before. So your brain does rely on it to some extent, in the sense that it needs that signal, it needs a clear signal to function, but it's not going to inherently make any mechanism worse by having the hearing aids on. I hope that makes sense there. And then we have a couple more minutes. I'll hang out till 12:15 if anyone else has questions, those that need to pop out, hopefully go get some lunch. Thank you all for coming. Thank you for listening. Again, I hope this was helpful and interesting to everyone. And there was some tidbit in there that was new to you. Again, as an audiologist, I'm here to support people in their hearing. We want to make sure that you know that we are not here just to sell hearing aids. And so that is a component of what we do, but our true goal is to really treat your hearing loss and to give you the informed information that you need. Question, I saw the comment as far as Eargo. I'm not going to comment on a specific brand because it's going to be an opinion on there. I just would comment that people be careful what they buy online and make sure that things fit them appropriately and work appropriately for them. What is the difference between the two hearing aid brands? There are a number of hearing aid brands. So at my practice, we have 7 different ones. As a whole, one hearing aid brand works the same as another if we were to just do tests on them. They all do their own tests and they all say their product works better. Each of them have a niche, so some work a little bit better with a certain type of hearing loss. Some of them work have a little better rechargeable. Some work a little better with Bluetooth. Some of them have a little better as far as processing. Some of the companies have better as far as high frequency hearing loss. Some people have better bass. Brand honestly comes down to a preference on what the patient's looking for in the product. So here we do an evaluation I find out what we're looking for, we narrow it down into a product. Sometimes when someone tries one brand, they just don't perform as well as they think they should, or there's some difficulties in how their brain's processing with that product, in which case we will sometimes try a different brand. Each one has their own algorithm and how they work. And so someone preference-wise may prefer one brand over another. All right. Thank you, Mr. Two. I recognized your name on here. All right. So I hope you all, again, have a great day. We have about 5 more minutes. If anyone has questions, I'm happy to answer them. So I'm hoping, so there's been a number of brands that have been out. Mary Ryan's question is, were there any major changes and improvements in clarity or anything coming out in the near future? So as I wear hearing aids, I do try out the different hearing aids. I got new hearing aids last year. My other hearing aids I'd have for about 4 to 5 years. I would say I noticed some improvement for clarity. It wasn't necessarily a world of a difference. Typically, it's about every 5 years that we can say, okay, people notice a significant difference in the clarity. There's tons of changes in the technology as far as now we have this that works and this app works better and this works better and how it works on the phone. But we are seeing more improvements with clarity. I also know that some of the companies are really working on how the hearing aids work related to how the brain's processing sound, which is going to improve the perception of clarity. And so that is something I'm really hoping in the next couple of years to see some more improvement and how it works and how I can adjust it to really address some of the processing components as well. So again, there's always, all the brands come out with something new every year to 2 years. The last couple of years have been really focused on some of the tech components. And so we're expecting some kind of new things. And there's been a few companies that have come out with, one of the companies came out with a new hearing aid that does analyze things very quickly. So as it analyzes the environment at a faster level, it's going to improve the clarity. So as far as what you have had 3 years ago, they may or may not be significant improvements at this point, depending on the brand and level that you have. I would say in the next year or two to really kind of look in to see what's going to be out, because I'm expecting there's going to be some improvements. And I think with the option of having over-the-counter hearing aids, that we're going to see it kind of force the market for things to improve as well there. All right, so looks like we're just, it depends on the company as far as release date. Some release summer, there's a few that release in the fall and a few that release in the spring. There was a company that did just do a release in June, but they vary throughout the years. Most of the companies stay with their line, but they do kind of do different from each other. So that most companies there's not a release of 7 new things at one time. There's typically 3 and then 6 months later and a couple other options. We have just a couple more minutes here if anyone has any more questions for me. Hopefully I was able to go through the chat box and answer most things. I think I hit all the main components in the chat box. All right, so I'm going to go ahead and kind of finish up here. If you have any questions, feel free to reach out to us here. We're happy to help you with any of your healthcare needs. There's lots of great audiologists in the area, so we're not the only ones, but we are here to help those who do need support or help. Otherwise, I hope you all have a great rest of Friday and a happy weekend.